Yes. Yeah. So that part is done. A 5 day old term. So a 5 day old term neonate presents with persistent jaundice and a dark yellow urine. On examination, hepatomegaly is noted and total serum bilirubin is 11.8, where direct bilirubin is 5.6. Liver enzymes are mildly elevated. So the direct bilirubin is 5.6. So when there is more than 20% of total bilirubin, if there is more than 20% of total bilirubin, the direct component is there. If the conjugate bilirubin is more than 20% of the total bilirubin, so 5.6 is very significant over here. So more than 20% of 11.8 is 5.6. So that means the patient has significant conjugated hyperbilirubinemia. And what are the important causes for significant conjugated hyperbilirubinemia? The mnemonic is Dr. Bhatia. The mnemonic is Dr. Bhatia. D for Dubin Johnson, R for Rotor, and B for biliary atresia. Breast milk jaundice, Crigler-Najjar, neonatal hepatitis, these all are causes of unconjugated hyperbil. This baby is having clay color stool because clay color stool is only and only seen in conjugated hyperbilirubinemia. That is why C becomes the best answer. A baby born at 30 weeks developed respiratory distress shortly after birth. X-ray findings are shown below. So it's a very beautiful picture of the white out lung, pure, clean white out lung. So white out lung is seen in respiratory distress syndrome. Yes, Anukruti Agrawal. And in this condition, definitely we're gonna give surfactant to the newborn by the in-shore technique. Surfactant to the newborn by the in-shore technique will give. That is intubate, surfactant, and extubate. Which of the following is not a component of the Apgar score? So it is appearance, pulse, grimace, activity is there, and respiration or respiratory effort is there. But blood pressure is not a component of the Apgar score. Yes, Himanshu Shekhar, very good. 34-weeker neonate came with apnea, bradycardia, and desaturation. 34-weeker baby, apnea. What do you want to do? So apnea is temporary. Yesterday I told you temporary stoppage of breathing for more than 30 seconds, more than 20 seconds actually. And what is the drug of choice? The drug of choice in this condition is nothing but caffeine citrate. The drug of choice in this condition is caffeine citrate, apnea of prematurity, that you should know. Okay. Why it is not phenobarbital? The drug of choice for neonatal seizure. The drug of choice for neonatal seizure is phenobarbital actually. So that is why this is not a neonatal seizure. And what else? Why it is not dopamine? Dopamine is given in shock. That is why it is not the answer is surfactant. It is a 34-weeker baby. Definitely we can give surfactant, but the examiner is asking about the apnea of prematurity topic. Yes, Dr. Sharon, why not surfactant? Because for surfactant, the baby should have kind of a white out lung. The baby should definitely have distress and all. Apnea, the specific word apnea, temporary stoppage of breathing for more than 20 seconds. That is apnea, and that is why automatically caffeine citrate is the best option. Okay, surfactant, the quest for surfactant, this is the question. This is the question of surfactant. A 30-weeker baby, respiratory distress shortly after birth, X-ray showing white out lung. The treatment for this baby will be surfactant therapy. There will give surfactant because the question looks like a surfactant. That's why. And here the question apnea is there. So the question looks like a caffeine citrate. A term neonate came with vomiting and scaphoid abdomen. Where do you see scaphoid abdomen? And breath sounds are specifically decreased on the left side. We're talking about very important. Yes, this is the Oscar, my doggy. Oscar also can answer this question. This is the congenital diaphragmatic hernia. And if I ask you a question, diaphragm is supplied by which nerve? Diaphragm is supplied by phrenic nerve. Diaphragm is supplied by phrenic nerve. And what is the root value of phrenic nerve? The root value of phrenic nerve is C3, C4, C5. C3, C4, C5 is the root value for the phrenic nerve. A 3 days old neonate with complaints of breathing difficulty and choking. Yeah, choking after feed. And the duty doctor advise an X-ray. If you focus the X-ray very carefully in this X-ray, there is coiling of the nasogastric tube. There is coiling of the nasogastric tube. So where do you see coiling of the nasogastric tube? Tracheoesophageal fistula. And what is the name of the classification? It is gross classification. How many types are there? There are 5 types: A, B, C, D, E. Which is the most commonest type of TEF? It is type C, followed by type A, and the least common is type B. Next, a baby is born with heart rate less than 100 beats per minute. Okay, heart rate less than 100, irregular respiration and cyanosis. After drying and stimulation, what is the next immediate step? Simple. It's a very simple question. Heart rate less than 100. What do you do? Heart rate less than 100, we do bag and mask ventilation, which is also known as positive pressure ventilation. And this bag and mask ventilation is done for how many seconds? It is done for 30 seconds. If the baby was having heart rate less than 60, then you would have done what? Then I would have done chest compressions and bag and mask ventilation in the ratio of 3:1. And this you would have done for 60 seconds. This you would have done for 60 seconds. So these are the important points you should know. Question number one, X-ray white circle. X-ray white circle is just like a artifact. That's nothing. It is just an artifact. Okay, just an artifact. Okay. Yeah, today नीचे aunty के आया हूँ ना. Today auntie's house have come with glass. Have not bought the glass actually. That's why. Yes. Okay, next question, please. A neonate came with abdominal distension, bloody stools, and pneumatosis intestinalis. So you only say bloody stool is means GIT problem, and pneumatosis intestinalis is specifically for necrotizing enterocolitis. What happens in stage 1A of necrotizing enterocolitis? In stage 1A, you will have occult blood in the stool. In stage 1A, you will have occult blood in the stool. Yes, here, Shri, I agree with you. And stage 1B, you will have gross blood in the stool. Number one. Number two, what happened in stage 2A and 2B? The mnemonic is P and P. In the P, you have pneumatosis intestinalis. You will have pneumatosis intestinalis that you see in stage 2A, whereas portal vein gas, you will see in stage 2B. And same happen in stage 3A and 3B also. P and P is the mnemonic. P for peritonitis features you will see. P for peritonitis feature and P for pneumoperitoneum. P for pneumoperitoneum. So this is stage 1A, 1B, 2A, 2B, 3A, 3B. So yes, exactly. Pneumatosis intestinalis. Yes, my dear, we're talking about stage 2A. They ask in exam, where do you see portal vein gas? Where do you see occult blood in stool? Yes, Shivang, you are right. The name of the classification for NEC is modified Bell's staging. I agree with you. Yes. So you have to calculate the Apgar score over here. So a baby is born by the normal vaginal delivery. A 1 minute heart rate is 90 beats per minute. 1 minute heart rate is 90 beats. So no heart rate less than 100 and more than 100. So 90 beat, one number I will give. Baby shows some grimace. Grimace word itself comes in one number. So one number. Irregular respiration. Again, one number. Some flexion of the limbs. Some flexion, one number. Good flexion, two numbers. The body is pink with blue extremities. That is acrocyanosis. That is one number. The total number 1, 2, 3, 4, 5. The total number for this question is nothing but 5. This question will definitely come this time. A term newborn is 2.5 kg, 50 centimeter. Calculate the Ponderal index. So how do you calculate the Ponderal index? It is grams upon centimeter cube into 100. Grams upon centimeter cube into 100. So baby's weight in grams 3500 upon baby's length in centimeter 50 into 50 into 50. That is centimeter cube into 100. So how much it will come? So yes, very importantly, 2.4. 2.4 becomes our roughly the best answer. So that's the answer for this question.